Hello everyone, so today we will be discussing about the pharmacology of Vinca alkaloids. So as everyone knows, Vinca alkaloid is a plant based or plant derived drugs, okay, which are generally isolated from the periwinkle plant, okay. The biological name for it is Catharanthus roseus, okay, which belongs to the family Apocynaceae. This Vinca alkaloids highly possess the activity of antimitotic, antimitotic and antimicrotubular properties. Antimicrotubular and antimitotic properties are generally possessed by the Vinca alkaloids. The chief Vinca alkaloids are vincristine, okay, and vinblastine, which are also the drugs that are also used for the clinical purpose. This vincristine is generally used for the lymphatic, okay, lymphatic leukemias. Lymphatic leukemia, and it is also used for generally acute lymphatic leukemia, and it is also used for Hodgkin and non-Hodgkin lymphomas. And the vinblastine is generally used for Hodgkin lymphomas. Okay. Now the antibiotics that are your bleomycin and cisplatin. Your bleomycin or cisplatin can be your bleomycin and the cisplatin can be generally used with this vincristine or vincristine or vinblastine, that is with the Vinca alkaloids, to treat the metastatic testicular leukemia, or you can say cancer. Okay, now let's understand the mechanism of action. So generally, as we all know, this Vinca alkaloids are very cell specific. Okay, these are very cell specific. So these Vinca alkaloids bind to the microtubular protein. Okay, that is specifically beta tubulin, with the help of, okay, and they generally inhibit polymerization with alpha tubulin. Okay, as we all know, it is very cell specific, so they go to the microtubular protein, specifically the beta tubulin, which inhibits the polymerization with alpha tubulin, which due to which the mitotic spindle is not formed. Okay, mitotic spindle is not formed, and due to which it leads to the inhibition of cell cycle at M metaphase. Okay, there is inhibition or stopping of the cycle at metaphase, and this exerts the cytotoxic effects. Okay, this generally exerts the cytotoxic effects. So Vinca alkaloids are microtubular proteins, bind to microtubular proteins, that is beta tubulin, inhibit the polymerization with alpha tubulin. Mitotic spindle is not formed. It inhibits the cell cycle at metaphase or generally M phase and exerts the cytotoxic effect. Now let's discuss about Vinca alkaloids. So the Vinca alkaloids are not generally orally absorbed. They are not orally absorbed. So Vinca alkaloids are given by IV route. Okay, they are metabolized by the enzyme CYP450 in the liver, and they are generally excreted by the biliary tract. They are excreted by the biliary tract. Now, what are the contraindications for this? So generally, if I'm talking about the contraindications, so in contraindication, it is not to be given to the pregnant women, lactating women. Okay, and it now whoever is undergoing the treatment or associated with the treatment with Vinca alkaloids should not be undergoing any kind of vaccinations. Okay, now what are the adverse effects for Vinca alkaloids? So generally these Vinca alkaloids are related to the psychology or psychotic effects. So generally the person may face tremors, seizures, okay, irreversible coma, peripheral neuropathy, etc. like conditions. Okay, and alopecia is one of the major causes that are caused due to the generally in the chemotherapy of the malignancy. Then you can also, or the patient may also face anorexia. Myelosuppression is common along with the bone marrow suppression.